And welcome to our webinar. My name is Ronna Schaefer. I'm with the State Capacity Building Center Infant Toddler Specialist Network, and I will be your moderator for today's webinar. We're so glad you could join us from the Family Child Care Supporting Quality webinar, which is part of our series from Virtual Infant, Toddler, and School-Age Child Care Institute. We invite you to ask questions, to share your thoughts and ideas in our chat pod. So please continue to do that. We'll try to get to any questions that you have as we move into our presentation and conversations today. Hopefully, you have been able to join our webinar kickoff that was on October 2nd. If not, you will be able to get both the recording and the PowerPoint from that session as well as from today's session at our Institute homepage, which you'll see in the web links pod in the lower left corner of your screen. There are also additional resources there that we'll be mentioning today. So feel free to download those at your convenience. We will be referring to them from time to time. So our format for today will be as if we were doing a face-to-face conference, and we have a panel discussion. In just a moment, I'll introduce you to all of our panelists and our guest speakers. I want you to know that this will be interactive. There will be many opportunities for you to give your thoughts and ideas both in this chat pod and in special chat pods we'll pull over throughout our webinar today. We'll also have a couple of polls that we hope you will be able to participate in. Also, before you need to ask about a certificate, I'll let you know that in a few days, you will be receiving an email from us with the link to the webinar, and also that will include a certificate that you can print, a certificate of attendance, that you can print. There'll also be a great opportunity for some deeper discussions that I'll talk about at the end of this webinar. And there'll be a link provided for you to join us there. So at this time, I am going to invite my panelists and my colleagues to unmute and introduce themselves. We'll start with Michelle. Michelle, are you able to unmute either using *6 or your unmute button on your phone?
Hello, Ronna, can you hear me now?
Yes, Michelle, welcome.
Thank you. I'm Michelle Adams, a Technical Assistance Specialist with the National Center on Early Childhood Quality Assurance.
Welcome, Michelle. And Tina.
Hi, everyone, and welcome. I'm Tina Jimenez with the State Capacity Building Center Infant Toddler Specialist Network.
And Susan.
Yes, good afternoon. This is Susan O'Connor from the National Center on After School and Summer Enrichment.
Thank you, everyone. And I also want to introduce you to our guest speaker, Dr. Juliet Broma. Juliet Broma is a research scientist at the HERE Research Center at Erickson Institute in Chicago. Her research over the last 2 decades has focused on examining programs and systems that support the family child care workforce and quality improvement. Through her collaborations with researchers and local, state, and federal policymakers and quality improvement initiatives over the past 2 decades, she's developed a deep knowledge of the systems that shape the home-based child care landscape, including subsidy, QRIS, accreditations, and licensing. Currently, she is the principal investigator of a multi-year national research initiative examining the quality of support offered by family child care networks to home-based child care providers. She also leads a new exploratory study on the decline of family child care in 4 states. She has published numerous peer-reviewed articles on home-based child care and serves on several national research advisory groups. In addition, Broma has recently been named as a co-principal investigator for a new project funded by OPRE regarding home-based child care supply and a quality project. Broma received her MS in Education from Bank Street College of Education and her PhD in Human Development from the University of Chicago. We are so delighted and pleased and excited that Juliet is here to share her amazing knowledge with all of you. And now that you know who we are, we're curious to know who you are. So you see before you magically appearing, thank you, Chandra, in the back room there, a poll. Please take a moment to fill in your role as it pertains to work with children and their families. If you have a role that isn't listed here, please check other, and you can put that in the chat pod at the bottom so we know who's here on our call. I'll give you a moment to complete this. I see a lot of people putting in other roles. It's always hard to capture everything when we're doing a poll. So thank you for completing this for us. I'll give folks another moment or two. Looks like we have more people in other roles than we have in the predetermined roles. I do see that about a third of you on this call are state agency staff from CCDF or licensing or infant toddler school-age specialists. I see a lot of folks that are from the TNTA, early childhood specialists. I see that in our other roles. I also see a few of you have checked off here that the child care resource and referral staff. I do see at least one family child care provider. Actually, I think I see 3 family child care providers, and we're so delighted to have you be able to take some time out of your day and join us. So it looks like we have everybody that would like to weigh in on who they are, and we appreciate that, and thank you so much. We'll move back to the presentation. Thank you, everyone. So I'm going to set the stage a little bit for why we chose to do this topic, family child care supporting quality, as part of our institute. Over the last decade, the landscape of home-based child care has shifted in 2 very important ways. The first shift is the increasing focus and investments at the state and federal level on promoting quality across early childhood education settings, with QRIS in about 44 locations. Nationally, 44% of eligible family child care programs have obtained a quality rating. In addition, as part of the 2014 reauthorization of the Child Care Development Block Grant, states and territories are now required to implement health and safety requirements for both licensed and license-exempt home-based child care providers who accept a subsidy. The second shift is a recent and steady decline in the number of licensed family child care providers. Today, you'll have an opportunity to hear from Dr. Broma and our panelists, who will discuss these shifts and consider how we, as state-level policymakers, family child care networks, training and technical assistance providers, in delivering high-quality care for all children with a special focus on infant and toddler school-age children. We are also excited to hear from you about your experiences. There'll be several opportunities for you to share your experiences in the chat room, and we encourage you to do that. At this time, before we begin, I am going to take a moment to introduce to you the Director of the Office of Child Care, Shannon Christian. Go back so you can see her beautiful smile. Shannon Christian serves as the Director of the Office of Child Care at Health and Human Services Administration for Children and Families. She's a former Associate Commissioner of the former Child Care Bureau at ACF, where she advanced President Bush's Good Start, Grow Smart Early Childhood Initiative and shaped the office's research agenda to better support state policy and spending decisions. Committed to effective prevention strategies, Shannon oversaw the launch of Illinois' home visiting program and was an active board member of Be Strong Families, a Chicago-based national nonprofit. Earlier in her career, Shannon was part of former Wisconsin and HHS Secretary Tommy Thompson's welfare reform team, serving as head of the planning section in the State Health and Social Services Department Office of Policy and Budget, and as senior advisor to the Secretary of Workforce Development. Shannon has an MPP from Harvard's Kennedy School of Government, a certificate in nonprofit management from Northwestern University's Kellogg School of Business, and an undergraduate degree in economics and international relations from California State University, Chico. We are delighted that Shannon is able to join us, and I know that she wants to say a few words of welcome. Shannon, hopefully you're able to unmute and can join us for a few words of welcome. Shannon, are you able to unmute? Press *6 to unmute. We'd love to hear from you. Shannon, we're working on unmuting you because we'd love to hear from you. So I'm so sorry that we're not able to hear Shannon's voice. We appreciate that she's on our call, and I know that she sends her warm welcome to all the participants of this call. So let's begin. We'll begin with Dr. Broma. Juliet, can you tell us what your research has taught you regarding the importance and the benefit of family child care as an option for children and families? Seems like we're having a little bit of audio issues. Can we unmute Juliet so she can join us? I apologize for these audio issues that we're having. Just give us a moment and we will work on unmuting Dr. Broma for us.
Hello?
Hello?
Hello,
I can hear you now.
Great. Sorry about that. Hi, everyone. I'm really excited. Yeah, good. I'm excited to be here with everyone today and be part of this discussion. So I thought we would start with just an overview of the prevalence of what the National Survey of Early Care and Education calls home-based child care, which of course includes family child care. The reason we start with this because of all the sort of shifts and things that Rana talked about, really the numbers of caregivers, providers, and children and families that are in these settings is why we should be talking about how to make these settings the best they can be for children. And so just an overview of some of the numbers. Okay. So we know from the National Survey of Early Care and Education, which is the first nationally representative data set that we have on home-based child care, that there are over 4 million home-based child care providers caring for more than 7 million children under age 5. Now, I just want to make a note about definitions. In the national survey, they refer to listed and unlisted providers. And they also distinguish between providers who are paid and those who are unpaid. Those who are listed are those who appear on some sort of government list. And providers who are unlisted do not appear on an existing publicly available list. But I'm going to use the terms family child care and family friend and neighbor care today because it's simpler. And they don't completely map onto those categories, but I think we can assume that most of those listed providers and those paid providers are family child care providers. And that's about 1 million out of the 4 million. The rest are unpaid and really could be considered family, friend, and neighbor providers, and that's about 3 million. Okay. Oops. Okay, we also know that the majority of children, the majority of infants and toddlers who are in home-based child care, including both in family child care and in family friend and neighbor care settings, that they're more likely to be infants and toddlers in these settings than in any other type of setting, certainly more than are in centers. We also know that as many school-age children are in family child care and family friend and neighbor care settings, as many as are in centers. We also know that home-based child care providers are more likely to be caring for children across the age range, that is mixed ages, which I know we're going to be talking a lot about today on today's webinar. We also know from the national survey data that home-based child care providers are more likely than other types of settings, early care and education settings, to be caring for children from families who are working non-standard, non-traditional hour jobs, as well as families living in rural areas, families who may have children with special needs, families living in poverty. Okay, so now I'm going to highlight some of the benefits. What have we learned from research about some of the benefits of family child care for children and families? And I want to preface this by saying that we have a very small research base on home-based child care, and so we don't have that much to draw from. But what we do know is that for children, there are great opportunities in family child care for those one-on-one provider-child interactions, responsive give and take interactions that we know are at the heart of high-quality care. And I always like to say that high quality can happen in any setting. It's about that relationship and those adult-child interactions. And that can happen in a living room, in a school building, in a family child care home. We also know that continuity of care is such an important piece of what happens in home-based child care, where it's one provider with child and the potential for that care to happen over multiple years. And we have a growing research base that really is important for positive child outcomes. We also think that we know there's less research on mixed ages, but there's potential for children learning from each other and building that community of learners in family childcare with those mixed ages. For parents and families, family child care has the potential to offer flexible hours and fees that can accommodate parents' non-standard work schedules, fluctuating paychecks, and unpredictable hours. Mixed age groups can also allow siblings to be cared for together under the same roof, and some parents may seek a linguistic and cultural match in values and practices that family child care may offer. And then finally, for communities, and we have very little research on this, but family child care providers, those who are regulated and getting paid to do this work, are small business owners. And they have the potential to serve as an economic and social asset in their neighborhood and their community. And we need to learn more about that role, but they do play an important role in their neighborhood and their community that ultimately does impact the families and children that they serve. Rana, back to you.
Great. Thank you so much, Juliet. It's so important to really think about all of the benefits of family child care. And I love that you included the community, because that is another benefit as we're looking at the bigger picture, right? So we all feel that it's so important to hear from providers about their thoughts and ideas, their successes, their challenges in providing this really important model. So with this in mind, the State Capacity Building Center's Infant Toddler Specialist Network, the National Center on After School and Summer Enrichment, along with the National Center on Early Childhood Quality Assurance, partnered over the last few years to convene several focus groups so we could hear the voices of the family child care providers. Tina, can you share with us a little bit about those focus group participants?
Certainly, Rhonda. I'd be happy to do that. So our goal was to learn how experienced family child care providers are able to meet the needs of children in their mixed age group settings. We then wanted to take the strategies that we heard from them and put those into a resource that could be used by both family child care providers and the technical assistance specialists who support providers to really address this challenge that providers face in how to provide high quality care with a mixed age group setting. We also wanted to learn what type of technical assistance and support providers feel that they need to improve quality in their family child care setting. And we wanted to hear the provider's perspective on the decrease in licensed or regulated family child care. And, you know, typically when we do develop a resource, we would go to the subject matter experts. Our team was very quick to realize that the experts on this particular topic are the family child care providers who do this work on a daily basis, who have figured out how to make mixed age group works, as well as the technical assistance specialists who support providers in doing this. So to ensure that this resource would be meaningful and it would be relevant, we drew upon the expertise of both of those groups. I think the most exciting thing about the Voices from the Field brief, which is currently under development and will be coming soon, is that it brings together the knowledge and experience of both family child care providers and TA specialists in addressing how to promote high quality family child care. I'll share a little bit about the demographics of our focus group. So we conducted 4 focus groups between June 2018 and June 2019. A total of 54 family child care providers representing 15 states participated in those focus groups. Most participants that we participated served children from birth to age 13. We made a real effort to recruit diverse providers for these focus groups. To attain regional diversity, focus groups were conducted in Chicago, Illinois, Orlando, Florida, and in San Diego, California. The Chicago and Orlando focus groups were held during the National Association of Family Child Care annual conferences to allow for greater geographical diversity. Participants' years of experience as a licensed family child care provider ranged from 1 year to 37 years, although the majority of our providers had 10 or more years of experience. Approximately 2/3 of our participants held a small family child care license, with the remaining 1/3 of participants holding a large license, sometimes referred to as a group care, a family child care group home license. The education of participants varied quite a bit, ranging from a high school diploma or less to possessing or working on an advanced college degree. And focus group participants were racially diverse. The San Diego focus group participants were bilingual, bicultural, English, Spanish.
Thank you, Tina, for this background about the focus group participants. We really appreciate knowing about all of this. Juliet, I'm wondering what you've learned about why providers begin this work.
Yeah. So again, I'm gonna turn to the National Survey on Early Care and Education, because it's really the best source of understanding some of the characteristics of the home-based child care workforce. And actually, just an aside, a second round of the NFECE is just been completed, I believe, 2019 survey. And so it's wonderful that we'll have those data to compare to the 2012 survey data when those are publicly released. So what does the 2012 NFECE tell us about why providers do child care? And here you can see that among, and this is just looking at those paid providers, both listed and unlisted. And again, we think that the paid listed providers are most likely to be those regulated family child care providers, but there's a lot of overlap. Anyway, among those providers who are paid and listed, close to half view their work as a career or a calling, a personal calling, while fewer report that they do the work to help out children or families. We also know that these listed paid providers may have greater job tenure and attachment to the field, as you know, we hear a lot about these caregivers who have been doing this for a very long time. On the other hand, more of the unlisted paid family child care providers, so these may include more informal caregivers, report doing the work primarily to help out families, and fewer report doing the work as a career or to help children. Many of these caregivers who don't participate in public systems, regulatory or quality, may be caring for children on a temporary basis, and they may not see this as a long-term career. Really, what these data tell us is there's a lot of variation out there, and we need to learn more. We sort of need to unpack these numbers and understand it better, especially for the different types of providers and caregivers and the different contexts in which they're working. Back to you, Ron.
Thank you, Juliet. And Tina, I'm going to turn back to you because I know we also asked this question in our focus groups about why they entered the field.
Yes, thank you, Rana. So the most common reason that providers identified for becoming a family child care provider was to stay at home with their own child or their own children, or they also identified that they entered the field to care for children of friends or relatives. Several providers mentioned that their own child had special needs and they were unable to find suitable care for their child. So that was another motivation for entering the field. Other providers said that they wanted to own their own business and that they viewed family child care as a professional career choice, matching what Dr. Bromer just shared with us. And some participants shared that they started off by providing family, friend, and neighbor care or unlicensed care, and then they transitioned to becoming a family child care provider.
Thank you for that information, Tina. It is very, very parallel to what Juliet just shared with us, but certainly hearing it from the voices of the practitioners in the field is really great, and they even elaborated a bit on what the research has shown. But we also know that recently there's been a decline in the number of family child care providers. And with that in mind, we know that the National Center for Early Childhood Quality Assurance has published a report entitled Addressing the Decreasing Numbers of Family Child Care Providers in the United States. And there's a link for that in your web link download pod. I'm going to turn now to Michelle Adams from the National Center on Early Childhood Quality Assurance to talk to us a little bit about that brief.
Thanks, Rhonda. Yes, you're right. We do know that the number of family child care homes, both licensed and license exempt, has steadily fallen over the last 12 years. The data that you see in this graph comes from licensing agency data that was reported by states in our child care licensing study. Information was collected in 2005, 2008, 2011, 2014, and 2017. In the survey, states report information on two categories of family child care homes. Family child care homes, small family child care homes, where one person provides child care services as the sole caregiver, and large family child care homes where two or more people provide child care service. The graph shows us the changes in the number of licensed child care facilities between 2005 and 2017. If we look at the blue line at the top, it shows a drop in the overall number of licensed centers and homes, a loss of almost 95,000 facilities. The overall decrease is due primarily to a steep decline in the number of small family child care homes. That's shown in the second line in gold. It shows that the number of these homes fell by 48%. The bottom line reflects a smaller decrease of 21% in the number of large family child care homes with two or more caregivers. And the dark green line at the bottom, second from the bottom, reflects a slight increase of 2% in the overall number of licensed child care centers. So the drop in the number of family child care providers can be a hardship for families, especially those more likely to use family child care, those that Juliet pointed out. In their survey responses, state respondents said that increased regulations and the economy were some reasons for the decrease. And they also mentioned that many providers were aging and retiring. Other factors reported included low enrollment, changing demographics, and increased provider requirements. The number of family providers receiving CCDF subsidy payments has also decreased. This table reflects data from the Administration on Children and Families, and it shows the number of family child care providers receiving CCDF subsidy payments in federal fiscal years 2011 and 2017. Since not all providers take subsidy payments, these providers would be a subset of the providers that we show in the previous slide. But when we compare the numbers shown here, we see in the top row that the number of all child care providers receiving subsidy payments decreased by 44% from 2011 to 2017. And in the middle row, we see this drop has been particularly steep for license-exempt family child care providers receiving subsidy at 62%. And in the bottom row, we see the number of licensed small and large family child care providers receiving subsidy payments has also decreased by 36%. If you combine the numbers of lost license-exempt and licensed family child care homes receiving subsidy funding between 2011 and 2017, we see an overall loss of over 172,000 family child care providers. and of course fewer licensed family child care providers across the country, and a reduction in the number of providers who care for subsidized children, both licensed and license-exempt providers, means that families receiving CCDF support have far few options for child care. The reasons for the falling numbers are not the same in every community. Contributing factors most commonly identified, though, in anecdotal information that we've received from states and providers tells us that some of the challenges that family child care providers face are also some of the reasons that they share for leaving the profession, including long work hours, low or unpredictable income and lack of benefits, a lack of business expertise, declining enrollment and increased competition, rising costs of housing and insurance, and zoning restrictions. Tina, I know that you've talked with the focus group participants about this same topic. What did they share about why they may be leaving the field?
Yes, thanks, Michelle. Thanks so much for sharing that information. You know, I found it really interesting that our focus group participants did not specifically mention the challenges such as long hours or a lack of benefits, because we know that these are challenges. What focus group participants did share with us and what they did identify were zoning restrictions as a barrier to opening and operating family child care programs, as well as the fees that are associated with operating a business, such as the cost of a business permit or a business license. They also mentioned the increased paperwork due to requirements of multiple agencies and increased licensing requirements. Finally, our participants identified a challenge in declining enrollment, which makes it difficult for them to stay in business. So many providers shared that they have lost children to programs such as Early Head Start or subsidized preschool.
Thank you for that information, Tina. And I see that Lisa in the chat pod is discussing some of the reasons that she's familiar with as well, which brings us to our next chat pod that we're hoping that you can all share with us a bit of information about what you're seeing about why providers are leaving the field. So, Lisa, you started it in the first chat pod, but I'll ask you to move over to this chat pod, and I'll invite everybody to enter some of the things that they're hearing, they're seeing as they work in their communities and in their states. So I'll give people a few moments to add their thoughts. I hope you can all see this. In case there are some people on the phone, I'll try to read a few of them. I probably won't be able to read them all to you, but I'll read some. We hear retirement is one, licensing regulations. I think we're going to see that in a lot of these. Providers don't feel the compensation is worth the effort. Planning and zoning challenges, low enrollment. These are all things that we heard, absolutely. Once children are grown, they decide to go to a different occupation with more reasonable hours. I see more, they're aging out of the profession. We hear that a lot, and that is so concerning. So if people are aging out, we need to think about how we can get some new young people into this field, right? The infant sleep regulations, low reimbursement, lack of supports with difficult behavior. That's a significant issue that we hear as well. It's important, Mary Beth is saying, hi Mary Beth, is saying that it's important to think about the difference between leaving the field and leaving the regulated system. Such a really great point. And maybe, as I mentioned, we'll have an opportunity next week, and I'll tell you more about that, to delve more deeply into some of this. And I'm hoping that that might be one of the things we really talk about is people becoming unregulated. So I'm just going to give one more moment for people to weigh in on this, and really hope that you'll join our conversation next week where we can go a little more deeply into these thoughts and ideas. So I see a couple more people writing. I'm just going to give it like just a few more seconds, and then we'll move back to our presentation. Thank you so much, everybody, for weighing in on this really important piece. I'm looking forward to reading through all of this and summarizing it for our conversation next week. So Chandra, will you take us back to the presentation, please? Thank you. So, and I'm going to move now back to Juliet. Juliet, I know that your research has told us quite a bit about the challenges that family child care providers are facing. And some of these challenges may be contributing to the decreasing numbers. Can you share with us what you've learned in your research?
Sure. Thanks, Ronna. So we've learned a lot. We've learned and we're learning more. And as Ronna mentioned earlier on, my colleague Tony Porter from Early Care and Education Consulting in New York and I have a new study where we're looking at some of the factors behind the decline in 4 states. And in that study, we are really seeking to get a provider voice. So we are focusing on talking to providers about their reasons for leaving. And so we've been really thinking a lot about this. But I'm going to share now some qualitative and just some broad findings from research about the challenges, which you already know because they've all been mentioned, but I'll just give them a little more context maybe. So isolation and working conditions. This has just been, noted in across studies. We just know it from the field anecdotally. These are long hours that providers work. We know that from the national survey, actually, more than 60 hours a week in some cases. And I'm going to show you, I have some quotes here from our recent national survey of family child care networks where we talked to directors of networks about what they see as the challenges that providers face. And so here's a director who says they're just so isolated a lot of times. They don't have adult interaction, and everybody needs that. And so that is a challenge of the work itself. A second challenge is role burden. And I'm going to put the quote up here because I have heard a version of this quote so many times from directors, from family child care providers themselves. This director says the provider is the administrator, the teacher, the activity planner, the driver, the cook. I've heard many, many versions of that over the years. And it's true. Family child care providers often manage multiple roles in the child care itself, right? So they really are the family support specialist. They are the curriculum person. They are the business person. They are the nurturer. They are the teacher. They are all those things. But they also may have additional responsibilities. They may be caring for an elderly family member. They maybe have other caregiving responsibilities in their home. And we know that many home-based child care providers actually hold down other jobs just to make ends meet, in addition to taking care of children. Okay, a third challenge that we've learned about is limited access to information and resources. And this is particularly, I think, become something we want to pay attention to as more and more professional development and training resources and system standards and requirements go online. So many providers have limited access to reliable internet in their homes. Remember, they're not working out of an office, they're working in a home, and they may not have great internet service. They may rely on their mobile devices to access information, and we all know how frustrating and difficult that can be. So this is an area, I think, to pay attention to. Here's, again, one of our network directors in our study said, that they just need information, basic information about how to care for the children in their homes. So this network director said, trying to understand the child's emotions and how to work with the child. There's a lot of, what do I do when she won't stop crying? Why is he biting? Please help us connect with these children. And that quote is sort of haunting because it just points to the sort of the great need and desire for knowledge that's out there, and how do we get that knowledge and that support into the homes where it can help these caregivers. And then finally, caring for mixed age groups. I know we're going to talk a little bit more about that, but as we know, family child care is mixed age group care, and yet that can be challenging. And we have very little research on this. Our standards and our systems really are not don't reflect mixed age care. So, we have an early care and education system, licensing standards, QRIS that really is, was developed from a kind of single age classroom, age segregated. And so this is challenging. It's challenging in the work itself. It's challenging to take care of a baby, a toddler, and a school-ager who comes home at 3 o'clock and maybe wakes up someone who's napping. And it's also challenging to figure out how you fit into the bigger system. And here's just another quote, really about the general challenges of being a family child care provider. This director says, it takes a strong person to be able to open your doors at 6 a.m., sometimes going until midnight, taking in 1, 2, 3 children of varying needs and abilities. Oh my goodness, everything. You're mopping, you're cooking, you're changing diapers, you're providing experiences and activities. So I wanted to also just share some findings from some other research again, from our national study of family child care networks, where we identified 156 networks across the country in 38 states. And one of the things we asked in our survey was what kinds of training they offer to family child care providers. And while most network directors reported that they offer some training on mixed ages, or they may mention that topic in a training, fewer than half reported that their staff who work with providers have themselves received training on how to work with mixed ages. And that's really important because that's where a lot of support happens. That's where a lot of professional development happens in family child care, is through technical assistance in the home. So if that technical assistance person doesn't understand mixed ages or is only a specialist on infants and toddlers, they're not going to be able to necessarily help that provider think about, well, how do I include the school-ager and the preschooler while I have the baby in my lap. So that's sort of something to keep in mind. In another study, we did a statewide survey of child care resource and referral agency staff who work with family child care. Again, we found that less than a third report talking about mixed ages with family child care, and even fewer reported that they offered any kind of focused training on this topic. So again, pointing to some of the challenges of the work, but also sort of the challenges in our field. And that leads me to this really last point that I want to make, which is the system challenges. And we really think that this may be one of the reasons that providers are leaving, and it's been mentioned, and it was mentioned in the chat box that everyone just typed into. But navigating and participating in regulatory and quality systems such as licensing, subsidy, and QRIS is very challenging for many family child care providers. They face confusing and often conflicting requirements. The paperwork burden can be enormous. Technology, as I mentioned, is a barrier. Sometimes requirements, standards are not in a provider's first language. And I cannot emphasize enough low reimbursement rates as a challenge in this field. If we don't pay attention to reimbursement rates, providers are living in poverty, and the reimbursement rates don't lift them out of that. And so it's something that's really important. And here are just some quotes from our network study. This director is talking about paperwork. She says, we've had providers who said it's just way too much paperwork, and they're thinking about not staying in and continuing to do the work with subsidized families because they just don't think it's cost efficient and it's such difficult work. And then here's another director talking about the low reimbursement rates. the low rate, the transactional parts of it are so complicated and so hard, it is really breaking the back and frankly driving a lot of people who have a heart and the desire to take care of kids. And I think you're moving to more underground child care providers. And that's to the point that was brought up just a few minutes ago and that I know you'll all be discussing in your future webinars. But I think, really it's time to think about how our systems are, what role our systems are playing in shaping the supply of family child care. And I will just say that Tony and I do have a report coming out with some of this more qualitative data, so look for that. Back to you, Rana.
We will definitely look for that, Juliet. The report that you and Tony have done have been so informative. I look forward to reading all of that when it's completed and published. So one of the things I heard you say, and you said so much that really resonated with me, but one of the things that I heard you say was that one of the challenges that providers face is meeting the needs of children in mixed age group. And I see in our chat pod that Lisa is also talking about what training there is out there for helping providers be able to do that. So we're going to move to that a little bit now and talk some about what we've heard in our focus groups and what we know about mixed age groups. So at this point, I'm going to turn it to Susan and ask Susan to talk a little bit about some of the general strategies that we heard in the focus groups about working with children in mixed age groups. So Susan, can you help us out here?
Yeah, Rana, I'm very happy to take some time here to share out the valuable ideas that the providers shared with us during the focus groups. And these strategies emerged out of their, multiple years of experience. So in our review of the strategies they shared, we found that the strategies fell into about 6 major buckets that reflect the categories that you see up on the screen. And so I want to just give a summary and some highlights from these strategies. Under the general strategies, they talked about the importance of keeping group size small and staying below licensing ratios when possible, or perhaps solving the problem by adding another staff person or a volunteer to increase the capacity for more one-on-one attention, or to increase their capacity to do more age-appropriate activities. Secondly, to use a family model with older children, helping younger children on occasion. Also, keeping children together, because in mixed age groups, children learn from each other and learn to help one another. Perhaps the most important idea shared under the category of environment and materials is to select materials that can be used in different ways and by different age groups. There could be dramatic play materials and puppets that are used by all ages, but in different ways, obviously, or by providing the same activity like drawing, but with a range of different age-appropriate materials. An activity like drawing with a range of materials like thick crayons for toddlers and pastels for school-age children. Most providers mentioned the importance of having shelving or storage that can promote accessibility and safety. For routines and schedules, many providers suggested a family-like and flexible schedule that can change as infant toddlers' needs shift. And this way the schedule can be built around meeting the needs of infants and toddlers, their nap times, their diapering, their feeding schedule, to determine when to plan quieter activities or outdoor play or activities where the older children can be involved independently. One of the most important strategies that providers mentioned is to build engaging curriculum by talking to families and speaking directly to the older children to learn about and build on children's interests. The activities in a mixed age group can reflect overlapping interests and independent activities. And interest areas can reflect different individual interests. So we've mentioned before that older children can be great as a leader of an activity. And if we're tapping what they're really passionate about or have a special interest or skill in, they're going to be more effective in providing that peer leadership role. Family child care providers in our focus groups also talked about the importance of tapping community resources. They use their local libraries. They have memberships to places like nature parks and water parks. They seek out help from volunteer organizations like churches, like youth organizations. And of course, they keep lists of community supports for parents so they can make timely referrals. And finally, they also talked about the importance of building relationships with families by building trust. As two providers explained, we work on having a relationship with parents and building parents' trust so that they will come to us for advice. The last category is planning and preparation, and this was mostly focused on the importance of preparing things ahead of time. As Juliet shared, we had the quote of the person that starts out at 6 o'clock, and we know that providers are working 60 hours a day. So when does this planning and prep happen? It's got to happen ahead of time. And they said to be sure to consider pickup and drop-off times, prepare meals ahead, prepare curriculum materials ahead. And Rana, turn it back to you.
Thank you for this overview. We heard so much wonderful information from the focus groups. And we also, in the focus groups, really talked about some of the specific challenges that family child care providers were having. And we focused on first infant and toddler challenges. So Tina, can you tell us a bit about what we heard regarding the challenges specific to caring for infants and toddlers?
Yes, Rana, I'm happy to do that. So one of the most common challenges that was identified by the focus group participants was how to provide responsive, individualized care and one-on-one attention for infants and toddlers while you're simultaneously trying to meet the needs of the older children in the group. So for example, how do you engage in responsive interactions like serve and return during a diaper change or while you're feeding an infant when you're also responsible for supervising and engaging with the other children? And that can be a real challenge, as we know. So to address this challenge, we collected strategies from technical assistance providers, and they identified they had quite a few suggestions. You can see some of those suggestions in the upcoming briefs that will be coming out, but I'll just highlight one of them for you today. They suggested that, that family child care providers plan activities for older children to engage in during infant-toddler routines. So by pre-planning activities to bring out and introduce when you know that you are doing a diaper change or you're going to be feeding an infant, you can reduce the need to have to rush through that important child care routine. And as we all know, of course, those routines are, of course, the curriculum for infants and toddlers. Providers also shared concerns about keeping infants safe and allowing freedom of movement while older children are engaging in more active curriculum, such as music and movement or engaging in large motor play. In response to that challenge, PA specialists again offered multiple strategies, including arranging the environment to ensure ease of supervision. And because family child care providers often use multiple rooms in caring for children, that can be a bit of a challenge. However, it does present an opportunity for coaches and providers to think about that together, to think about how they might accomplish that with the unique family child care environment that the provider is working within. And finally, our focus group participants shared behavioral challenges related to the overstimulation of infants and toddlers. It's really important for providers to understand that typically the younger the child, the less stimulation they can effectively handle. We know that this can be a challenge in a mixed age group setting. So to address this challenge, our TA providers shared strategies to minimize overstimulation by creating a calm and peaceful environment, which would benefit all children in the program. And they really wanted to emphasize that a really important thing that TA providers can do is help family child care providers recognize the signals of overstimulation and then adapt their interactions and the environment in response to infants' cues.
Thank you, Tina. I think all the points you brought up are so important, and I wish we had time to spend hours and hours talking about this. Again, this can be something we delve a little more deeply into on our follow-up conversation next week. But now I'm going to turn it back to Susan, who's going to tell us a little bit about what we heard regarding meeting the needs of school-aged children.
Thanks, Rana. The first thing to consider really in supporting school-age children in family child care is that they represent a very broad developmental age range, and so we're going to need to plan differently within these age groups. So I usually think of 3 different age groupings for school age. 5 to 6-year-olds, they're transitioning really from preschool to school age. They might arrive at a family child care home needing a nap or at least some downtime. They like a clear and predictable schedule. The 7 to 9-year-olds really like to select their activity choices, and they enjoy hands-on discovery activities, working in groups, and they really like to build a new skill over time. The 10 to 12-year-olds are, of course, pre-adolescent, and they're going to want increased independence, time with their peers, and they're ready for increased responsibility. Family child care providers said that it's sometimes challenging to meet the needs of school-age children. They've found that if school-agers aren't fully engaged, they may be disruptive. A key to increasing engagement of school-age children is to focus on increasing their voice and their choice in developing activities for them. Research certainly shows that by increasing voice and choice for school-age children, they're going to be more engaged. They will show improved self-management. They will take more initiative, and they have an improved sense of competence. Family child care providers can find out what children want to learn and do through simple conversations, talking with their families, direct surveys for the children, or introducing them to new activities to learn where their passions are. As we get to know each child and increase their engagement, we can identify the right balance between mixed age group activities where they might take a helper role and independent activities where they can pursue their own interests and passions. It helps to plan these activities ahead of time and create opportunities where a child can pursue an activity with limited assistance. A provider can do this by creating activity stations that relate to children's current interests, or the Voices from the Field brief, which will be coming out in a while, includes web links for a lot of independent activity ideas like community service or project-based learning, or ideas on science, art, and math, and book lists by interest areas. Many focus group participants said they found it particularly challenging to provide homework support, especially in the late afternoon when younger children that they're working with may be tired, or during family pickup time. Yet families often want their provider to set a priority for homework support. The key is going to be really for providers to create an approach that is realistic for them and responsive to families, that take into account families' pressures around doing homework at home. So if the provider doesn't have the time, they may work to create an approach that's a balance. Perhaps they could bring on a high school or college student or retired teachers to volunteer with homework support, At the least, a provider can create a quiet space and needed materials so children can work independently to complete as much of their homework as they can. And even if a provider can't support homework at all, school success can certainly be supported by providing just 20 minutes of sustained silent reading. Rana, back to you.
Thank you. Again, great information. I know that we could talk about this for long periods of time, and we will next week for those of you who can join us. So I'm going to turn it back now to Juliet. We've talked here a bit about some of the challenges, and now let's move to some of the strategies that we've learned can really help support family child care providers. So Juliet, why don't you start us off with this?
So just broadly, in our review of, again, a small body of research on strategies that support home-based child care providers, and we were really looking at what does high-quality support look like, and we did a comprehensive literature review and a model and all that. If you want that, I can send it to you. But some of the things that we identified from the literature as being most likely to support quality in home-based child care is coaching and home visiting and mentoring, right? That one-on-one help in the provider's home, but it's especially effective when combined with training. So we know from the research that training workshops alone on strategies to work with kids may not be enough, that it's that training content combined with someone helping you put it into practice that really makes a difference. So to what extent are we really linking our training offerings that so many providers participate in to more tailored and customized TA? Qualified staff, I'll just say that the quality of support is only as good as the staff who deliver those support services, and that it takes a set of knowledge and skills to work with family child care providers. They have to understand the unique, distinct features of family child care, that it is not a classroom, and they need to understand how to develop supportive professional relationships, because quality improvement only happens in the context of strong relationships. We really have learned that across fields, and it applies in this field as well. Sustainability supports, we've talked a little bit about that today, not much, but those business practices are really important. I'll just say that if the provider cannot keep her door open in the morning to welcome children and families, then it doesn't matter what quality of care she's offering. So, and I think we can think broadly about sustainability. So it's those business and administrative practices for our regulated, more professionalized family child care providers, but even for family, friend, and neighbor caregivers, it's that what's the provider's own well-being, and how is she doing? Because she is the program, right? She is the caregiver, and what does it take to what do providers, what does our workforce need in order to sustain this work, right? In order to sustain themselves so that they can offer high quality care. And then the other thing, and I'm going to share a little bit about that, is peer support. We don't know enough about peer support. I saw someone mentioned it in the chat box, but we're learning more and more that peer support can both reduce that isolation that's such a challenge in family child care, but can also providers are experts about what they do. And I think we sort of missed the boat there. Like, there's just this huge opportunity to leverage the incredible expertise that's out there. And what happens when you create opportunities for providers to get together in a structured setting to share and solve problems and strategize together around care of children. I think it can be very exciting. This is just a very small example, again, from our network study. It's an example of how a network used home visiting, which they have home visitors who go in, but they used it in a tailored approach. So this director talked about a provider who was struggling with mixed ages. And so they decided in 1 week to do this really intensive home visiting. They went in for a whole day trying to figure out the environment and the team, and then they came back a few days in a row trying to help the provider who had newly a new infant in care and was really trying to redo her routine and figure out how to manage. So it's just an example of how short-term home visiting might be used in a more intensive way. Now, again, this and the strategies I'm going to show on my next slide, we don't have like research evidence that this leads to a certain set of outcomes, but it's something we want to know more about, right? We need a lot of innovation in our field because we don't have a strong research base. We need to identify those promising strategies that then we can study more. And speaking of promising strategies, these two slides just have some examples from a project we just are finishing up at Erickson, where we piloted the Breakthrough Series Collaborative, which is a quality improvement method from health sciences that involves rapid cycle testing. And our collaborative focused on supported providers to work with toddlers in mixed age groups. And the teams, the 10 Family Child Care Network teams, strategized and innovated all year around technical assistance in home visiting and peer support. And they generated all of these exciting strategies, like helping providers observe and plan, using video for observation of toddler behavior to help them think about how to plan for mixed stages. Some of the peer support strategies are really cool. Having providers visit each other's homes to learn about environments for mixed stages. Initiating provider-led text groups, Facebook pages where providers go on a weekly basis saying, hey, can anyone help me solve this problem? And providers brainstorming and posting pictures and videos about how they do mixed stages. Communities of practice is a really promising strategy that some of you are probably using in your states and communities. So these are just ideas that have been generated from some of the work we've been doing that we need to learn more about and we need to understand how the potential here for improving quality. Okay, Rana.
Thank you, Julia. We do have a question that I want to very briefly take a moment. Roxanne has asked if the home visiting that you're discussing is the traditional sense used with parents and children.
I'm so glad you asked that question, and I was aware as I was saying it that I needed to sort of back up and define. We don't have good definitions in our early care and education field, and especially in family child care, about what we want to call it when someone from an agency comes in to a family child care home to help her work with children and families and her business. The field calls it coaching, mentoring, technical assistance, and home visiting. There are very few examples out there of home visiting, of agencies using home visiting curricula from the home visiting with parents world. But it is something that actually my colleague John Korfmacher and I, he's a home visiting researcher, have been really interested in, like what are the parallels. I know there's a new brief out on home visiting and family child care from Child Trends. It's something we need to learn more about. Home visiting and child care are very siloed, and I think there's a lot of things we can learn from the home visiting world about how to do this professional development in homes more effectively with providers. I mean, there's obviously big differences. So when I say home visiting, I am talking just about someone going into a home. I'm not talking about an actual curriculum or program.
Thank you for that clarification, Juliet. I know there's a lot of chat in the chat room about home visiting programs, and I'm going to let that continue in the chat room as we continue on with our presentation here, because we are coming towards the end. I do want to take just a couple of moments to bring over another chat pod, though, to ask what additional strategies have all of you out there found. So we've got two chat pods here. The first one is, as training and technical assistance specialists, what strategies have you used to support family child care providers, specifically around working in mixed age groups? And if for those of you who are providing the direct care of children or the family child care providers, there's a chat pod on the right where we hope you'll add some of your strategies in supporting those children in your care. So we're just going to take a couple of minutes to get a few ideas in here. Unfortunately, we can't spend a lot of time on this, but it'll just get us started really thinking about these really important strategies. Jody, I love your strategy, divide and conquer. Something I used to think about a lot when I was providing direct care. We have a lot about coaching, collaborating with associations. Lisa shares that Colorado is piloting a curriculum for family child care homes this fall that will benefit providers by reassuring them that infants and toddlers are having good experiences. That sounds wonderful, Lisa. We'll have to connect to learn more about that. I see that Andrew is saying regular visits, coaching with identified providers, and teaming to support the needs of others, annual conferences, more about peer support, great strategies to build on what Juliet has shared to us. I am going to move us back to the presentation now. Thank you. And I'm going to turn us back to Juliet again, who's going to share a little bit about what they've learned and their new report on the conceptual model for quality in home-based childcare. So Juliet, would you share a little bit about this?
Sure, just real quick. This brief is available, and I know there'll be a link to it in follow-up communication. To address questions about quality improvement, we really need in our field to understand the distinct and unique features of home-based child care quality to help us better design standard system supports. So Child Trends convened a group of experts to develop a conceptual model that could be a starting point. Oh my!
Did we lose you, Juliet? Are you still with us?
I am so sorry. That was my cat.
Oh, we understand. We understand. I thought we lost you. I'm glad you were still with us.
Oh, my entire computer out on the wall. Okay, I'm so sorry. So, I'm sorry. Yes. So anyway, convened a group of researchers to develop a model, a conceptual model of quality for home-based child care. And there are really three pillars or components of quality that we identified. One is foundations for the sustainability of care. These are really seen as the precursors to quality, the environment, the provider's own well-being, community, business practices. The middle component is lasting relationships, that continuity of care that we've talked about throughout this webinar that we know lead to positive outcomes for children, children's relationships with each other, provider-family relationships with the community. And then the third sort of pillar or component of quality in home-based child care is what we call opportunities for learning and development. And this is really about that there are available materials, resources in a familiar and authentic environment that is culturally relevant to children's experiences, that providers really build on and capitalize on the everyday and familiar. That is what is so special about home-based child care. It is in a family setting, and that we really want to understand that more and highlight. I will say that this model, Rana, is really just a starting point for future research program development. And actually in the new OPRE project on home-based child care supply and quality, we're going to be building this model out even further.
That's very exciting, Juliet. Thank you for that. I mean, that we'll definitely be looking forward to that. The moment it's out, we'll make sure that everybody gets a copy of it because it sounds like it's going to be so helpful. And now I'm going to turn back to Tina for just a couple of minutes to share with us a little bit about what we've heard from providers that they're looking for regarding some support.
Sure, thanks, Rana. So not surprisingly, a lot of what providers shared with us was a very close match to what Dr. Bromer shared just a few minutes ago. Many of our participants identified the need for provider-to-provider mentoring. This was a very high priority by the majority of our focus group participants. They also requested training that are specific and tailored to family child care providers. Providers told us that they often feel left out of early childhood training and professional development opportunities that are really developed and designed for center-based programs. Participants wanted coaches and trainers to have experience in, respect for, and knowledge of family child care and what makes it unique. Cohort and hybrid trainings were identified as desirable by most of our participants. And participants expressed an interest in training topics that they felt were relevant to family child care providers, and that included working with mixed age groups, specific ideas for working with school-age children, and for working with infants and toddlers, trainings on parent engagement, and training focused on implementation of curriculum in the family child care setting. They also were in complete agreement about the need for funding to be able to provide high quality care for their children. They specifically identified a need for scholarships to enable them to go back to school, for grants to help with remodeling equipment and purchasing supplies and materials, incentives and stipends that can help them purchase curriculum materials, and funds for professional development, such as training, college classes, or CDA applications, or accreditation.
Thank you, Tina. Thank you, Tina. That was a very quick overview. I see in the chat box that a lot of people are really agreeing with some of the pieces that they heard here. So we've heard so much information today. I wish we had a lot more time to go into this even more. Before we go into our final ending, I did want to ask Juliet just to very briefly talk to us a little bit about some of the systems level support that that she has found to be helpful.
Okay, so yeah, so I think we just want to keep in mind, and a lot of this we've touched on, that there are so many systems and policies and programs that include family child care or have the potential to include family child care. At the federal level, of course, we have CCDBG and reauthorization, and the states are figuring out how to do this, and so we've talked about that. I'm not going to spend a lot of time on that, but the food program is another point of contact. The food program requires 3 visits a year in family child care homes. So thinking about how to make the most out of those visits, right? Thinking about all the ways that our providers do connect with systems and supports, and taking a new look maybe at how some of these supports are implemented. At the highest level of practice is the Early Head Start and Migrant Head Start partnerships, because these programs can be offered through family child care providers. And so thinking about how to build that, how to improve that, how to understand it. At the state level, of course, we have licensing, QRIS, thinking about those standards, and we've sort of touched on this today, but do those regulations, those licensing regulations make sense for family child care? What are the barriers? What's not working? Do QRIS actually reflect the realities of family child care homes? Where do family child care fit? Universal pre-K, this is something we do not know really anything about in family child care, but there are many states and communities around the country who are starting to use mixed delivery systems and deliver pre-K through family child care. And I believe this is really an access and an equity issue, right? Because if a provider can offer pre-K through her family child care home, she won't lose those 3- and 4-year-olds that makes her go out of business. The families get continuity of care. There's just so many benefits. So it's really something to think about. And then finally, and this has been mentioned in the chat box and elsewhere, that we really need to pay more attention to local zoning laws and small business rules. I know those came up in the focus groups, but it's, again, something we don't talk enough about. The providers talk about it. so they know about it. But it may be something that's driving people out.
So much to talk about, Juliet. So much to think about. I think maybe this webinar could have been twice as long as we gave time for, right? So much. So as we are closing, because we just have a couple minutes, I do want to bring your attention to what I've mentioned a few times is the breakout discussion session that we are conducting next week. You see the information here on the screen. In your follow-up email that you get with a web link, you will also get this information. So next week we are offering opportunities to go deeper into some of these conversations. You do not have to pre-register. The link for that Adobe room is here on the screen, and we will be sending it out to you in a follow-up email very soon. We hope you can join us. We'll take a look at some of the questions in your chat pods, and we will really delve more deeply into those next week. We have a time for infants and toddler focus, a time for school-age focus, and you're invited to participate in either one or both of those. And finally, I just want to bring your attention to the next two webinars. You see those here. You can register for those on the Institute homepage. The web link is down here in our pod. And before you go, we're hoping you'll take a moment to respond to 3 very brief questions. We really spend a lot of time looking at your feedback, really thinking about your responses to these questions, and it really helps us with our continuous quality improvement. So please take a moment before we sign off to answer these few questions, give us some ideas on other topics that might be of interest to you, and I'll give you a moment to do that before I end with a few closing remarks. Thank you so much for your responses. We'll move back to the presentation for just a few closing things that I wanted to mention. So as you can see, or you will see when you get your PowerPoint, there are some additional resources to what we have in the pod. But I really wanted to spend just a moment thanking you, Juliet, for all of your amazing, amazing information. I wanted to thank the National Center on Early Childhood Quality Assurance for your collaboration in this with the State Capacity Building Center and the National Center on After School and Summer Enrichment. We also really want to say a special thank you to the National Association for Family Child Care and the YMCA Child Care Resource Services from San Diego County, California, who helped us to organize our focus groups. And a huge shout out to all of the participants of those focus groups who lent their voice and to this conversation, which is so critical. So I want to thank you all for participating. Somebody did ask if we're getting certificates. Yes, you will get a certificate in the follow-up email. Thank you all so much for your time and your energy and for all the great work that you do for children and their families. Thank you so much. Hopefully we'll talk to you next week.